All right.
Great. Thank you. Hi, everyone. I'm Elaine Tagliareni, and I was formerly the Chief Program Officer at the NLN and retired from that role in December, but have been leading all the ACE initiatives at the NLN since 2009. So thank you all for being here. We're thrilled to present this free webinar to you to talk specifically about the Advancing Care Excellence for Pediatrics program, but we will also touch on the other Advancing Care Excellence resources that we have here at the NLN. So welcome, and I'm Elaine, as I say, and I want to introduce you to Andrea Browning, who's the manager at the NLN of all our ACE initiatives. Andrea will introduce herself and take us to the next slide.
Great. Well, thank you all for joining us this afternoon or this morning if you're on the West Coast. We're so pleased to be able to tell you about our newest addition to the Advancing Care Excellence initiative, which is Advancing Care Excellence for Pediatrics. We're very pleased to have be able to provide this webinar due to some generous funding from the Hearst Foundations, which has funded all of the ACE.P work. As you know, many of you with grant-funded initiatives, we are often asked to collect a few data points. So we will be doing 2 polls during this webinar. The first poll I'm going to do right now, just to show you exactly how easy it is. And the question number 1 is just how many people are watching the webinar with you. We know that sometimes people have more than one person watching on a big screen, and so we'd like to capture that for our numbers. So I'm just going to leave this open for a little less than a minute, hoping to capture some of your votes. And then at the very end, we will have another poll as well.
So thank you. Thanks, Andrea. Let us know how many are there. And the Hearst Foundations is always eager to know how many people we're reaching and what your responses are to the resources that they've been generously able to fund. Okay.
All right.
All set then?
Yes.
Okay.
Thank you all so much.
Thank you, Andrea. So let's go on and talk about the Advancing Care Excellence series in general. And we started out, as you know, with seniors and then realized that we could use the format that we had developed for the seniors of unfolding cases and teaching strategies in order to address other vulnerable populations. So we really think about vulnerability as individuals or populations, if you will, who are at risk for health problems resulting from socioeconomic circumstances, etc. And we really highlighted this in our ACE.P series, and today we'll have the opportunity to talk to you a little bit more about the social determinants of health. So all of our ACE series are teacher-ready curriculum tools, and they all take place in a wide variety of environments, as we've listed here, and they cross across courses. So even if we're in a senior course, you'll know that some of the cases deal with psychiatric issues, they're in the community, so they have a wide range of use within a variety of courses throughout the nursing curriculum. So even if you don't use simulation, there are monologues and the teaching strategies, so we really encourage you to go to the ACE website, and at the end, Andrea will show you exactly how to get there and how to access the resources, because they do focus on simulation. Each unfolding case has 3 scenarios, but they can be used with standardized patients, don't need to be used with mannequin-based series, and they have a wide variety of use. So thank you for being here and to hear about the series. And the next slide really tells you about the different types of vulnerable populations which are covered through our center at the NLN. As you know, the first group were the seniors, and many of you know Millie and Julie and Lucy and the cases that are involved with that. The Dorothy monologue have been known to many of you, and we encourage you to go there. AZ refers to a set of cases and teaching strategies related to Alzheimer's patients and their caregivers. And that was funded by MetLife a while ago. And our focus there on caregivers was in relation to AARP, which really has focused on caregivers. So for example, the Judy and Karen Jones case, Judy has dementia, which is progressing. Her daughter, Karen, moves in with her, and you get the experiences, and the students get to know a patient with dementia, but also the challenges of their caregiver as well. And so that is about dementia. It can be used in fundamentals, psych courses, as well as community courses as we look at the challenges for caregivers. ACE-V is veterans, and that really came out of the Joining Forces initiative, which First Lady Michelle Obama and Vice President's wife, Jill Biden, started about 4 or 5 years ago, asking all the national organizations to initiate ways for faculty to incorporate the special needs of individuals, particularly coming back from Iraq and Afghanistan, who experienced all kinds of morbidities that aren't necessarily in the curriculum. And let me just say, colleagues, that that's one thing that the ACE series does. We look at what are the gaps in the nursing curriculum? What group of people are we not necessarily focused on? And how can we create resources for that? So when you look at the ACE-V cases, Randy Jones is in a motor vehicle accident and also has PTSD, probably secondary to that. So you get the psych ramifications as well as the implications for their family in those cases. So they have a wide range of use. And just want to mention that Jenny Brown in the ACE-V series is an OB patient. She has PTSD with agitation, but she's 30 months pregnant. The fetus has cleft lip, and you get to deal with those kinds of issues. So please take a look because they're broader than what you might assume just by the title. ACE-D we did in collaboration with Villanova University, which some of you may know really have taken on persons with disabilities as a focus for their undergraduate nursing course. And those two cases really deal with a wide variety of issues with disabilities. Mary Lou and Rob Brady. Mary Lou is a young woman who had a stroke and then becomes pregnant. So it's another OB case within the context of disabilities. And Patrick Lake lost his leg and now is having cardiac issues. So they're in the community, but they have acute care problems, and you'll see them move in a variety of ways. ACE-P we're going to talk about today, and ACE-C, which is for caregivers, is a new grant that Andrea and I are working on now in collaboration with experts across the country on caregiving. And AARP is the lead with that. It's funded by the Hartford Foundation, and those resources won't be available for another year because we're in the introductory phases. So let's talk specifically now about ACE-P, which, as Andrea mentioned, is funded by the Hearst Foundations, and we're thanks to them for their continuing support of our ACE initiatives. So as we talk about ACE-P, let's think about from yourselves, and by the way, please use the chat function. We'd love to hear from you. And in this case, what do you think are the essential pediatric content areas in pre-licensure courses related to pediatrics? What are the areas that you, as a group, in your PEDS courses, and as you look at how children are cared for, that you see are those essential pediatric content areas? When we did this, when we talk about this, we hear from other groups, and I look forward to hearing from you. You know, we hear about asthma, growth and development, some behavioral issues, but sometimes they're not covered as acutely. I hear development from Jennifer, absolutely. That's a key component of pediatric curricula. So we hear the acute care cases, differences between adults, parents' needs. So I think that's a really good point, don't you, in the pediatric? This is the one part previously where you really got to deal with the child and their family. And as we developed the other ACE cases prior to this, we also wanted to think about the patient and the caregiver or the husband and the family in relation to it. Pediatric emergencies, child abuse, sickle cell, respiratory. Absolutely. Thank you. They're key to this pediatric curriculum. So as we were developing the pediatric cases, and as we moved forward with that, next slide, please, we really looked at how the clinical sites have varied in regard to pediatrics. So many of you, and I'm sure let us know, are using varied clinical sites, not just acute care, using home care, schools, ambulatory care, looking for a wide variety, because the NLN did a survey 2 years ago asking deans of School of Nursing what keeps them up at night. And the number one issue is clinical sites. And then within that context, the number one was pediatric and OB clinical sites. As less and less children are treated in acute care, I know you're out there in daycare and looking at other kinds of sites as possibilities for use in pediatrics. And the ACE.P focus is on really the wide variety of sites, primarily community sites. So let's think about what Healthy People 2020 told us about in regard to what we needed to be thinking about in pediatrics. And you'll see the arrows there of the highlighted areas from Healthy People 2020, which really provided much of the evidence for us in thinking of how we would frame the cases to cover these key essential areas. Injury and violence, which as you know, secondary sometimes to abuse, which is seen in this population. The mental health issues, depression in adolescents, autism, etc., are varied and can have an implication. Nutrition is an area that we decided to focus on, and it's very broad when we think about nutrition, and the resulting obesity, which you know has reached epidemic proportions in the adolescent population here in the United States. Oral health was somewhat new to us until we investigated and found out that it is also in epidemic proportions, that 20% of children have untreated tooth decay, leading to infections, decreased attention in school, and all those other problems. So we collaborated with New York University, which has a huge initiative, Smiles for Life, to look at oral health across the spectrum, but particularly in pediatrics. And then the social determinants, which, colleagues, became a major focus for us as we looked at these cases and how we can incorporate the social determinants, which are on our next slide. So look, I know you've heard about the social determinants, but let's focus on that for just a minute as a prelude to our ACE.P cases. Because what we learned along the way is, and I know you know the definition of social determinants, the conditions in which people are born, grow, live, work, and I particularly like age. And the factors, when adverse, which can really contribute to health, to self-care, and to early intervention. So we know that definition, but how much of that is in our curricula? And as we investigated this, we realized that we all teach health in fundamentals and throughout the curriculum. And we teach it as the absence of disease. But then so much of the curriculum is acute, episodic, disease focused. And although students have a broader definition when they leave, do they think about health as the absence of disease? Perhaps. And as we investigated further, when we get the broad definition of health, about 15 to 20% are our morbidities, are the common health problems, and they certainly implicate health. 10 to 20%, it varies depending on what research, relates to our genes and genomics. But 60% at a minimum are really related to the influences of environmental, socio-cultural, neighborhood type factors, which influence our ability to access healthy care as well as to be healthy. One of the major determinants of health in this country is our zip code, what zip code we're born in, what zip code we live and thrive in and continue our lives. That's a major factor in how we think about health. So as we looked at these ACE.P cases, you will see, colleagues, that the social determinants are very much a part. In fact, there are actual teaching strategies related to social determinants. So Andrea and I also want to alert you to Bright Futures. If you're teaching pediatrics, you're probably familiar with Bright Futures. It's a wonderful, wonderful website which helps you to look at common framework for well child care up to age 21. And within the context of Bright Futures, they talk about protective and risk factors that really contribute to how the social determinants affect care. And the protective factors are things like supportive family, community engagement, the role models, are there boys and girls clubs, etc. And there's a tremendous number of risk factors, which can be your living situation. I mentioned the zip code. How are you able to access childcare or not able to access it? Food security, which has to do with purchasing foods and vegetables, or food insecurity, which is really comes from poverty. Substance abuse, as well as intimate partner abuse and violence. So all those factors relate to the protective and risk factors, and Bright's Futures does a great job. So please go to that website. It's there on the slide, and it will tell you a bit more. And it also, this is one example of a screenshot we took from this, which tells you about all that growth and development and the well child visits and what the priorities are. For example, the 4-year visit, social determinants, risks, living conditions, tobacco, alcohol, and it also gives some guidelines on how to assess for that. So we wanted to mention this because it's a good website for you to go to, but even more so, it's because all of the teaching strategies and many of the cases link to the Bright Futures resources as a wonderful way for you to experience resources that will help you incorporate the social determinants in your pediatrics.
Great. And we do have a question in the chat box about what source can be used for the age of pediatric population and where would neonates fall.
Yeah, thank you for that contribution. One of the things that we're working on in collaboration with GW University, Dr. Ashley Davis Mahoney's, she is looking at, she's a neonate clinical specialist who's developing a toolkit for us related to incorporating the social determinants of health in the pediatric curriculum. So Bright Futures is a little bit more on the well child, not so much on the neonate, although it does include the neonate. But that resource, when it's up, and it won't be up till like 2019, January or February, but when it's there, I think it would be a wonderful resource for you to use on pediatric populations, including the neonate. So thank you for that question. So let's talk about the unfolding cases that we've developed through this. And Andrea and I will walk you through these fairly quickly. But as you know, each unfolding case, the first one is Thomas Sykes, who's 17 years old and obese. All of the simulations have 3 scenarios. Many of them include an inpatient unit visit, so you get some acute care. In this case, for Thomas, the inpatient unit is on a psych unit because he's depressed. He starts out in a primary care visit and then goes to a home visit later where he's further assessed for his obesity. He experiences bullying, which is a problem, and how you're working with adaptive factors. All of them include a monologue. So let's start now with having you listen to the monologue, which is in Thomas's words about his life. And as we said, they all start out that way with a monologue, and we'll have a chance to listen to it. It's about 3 minutes, and we're going to have you listen to it now.
My name is Thomas Sykes, and I'm 17. I live in an apartment with my sister Keisha and her 3-year-old son Tori. I've lived with my sister since I was 10 and my mom died from her diabetes. She was big and never ate what she was supposed to. My dad hasn't been in my life since I was born. I've been big for most of my life, but have gained a lot of weight since we moved. I don't know how much, but I know my clothes don't fit anymore. Keisha does what she can to get clothes for me, but I don't have much to wear. The worst part is that I know I'm gonna get diabetes, like my mom did. I'm not gonna live a long life either. We moved last year for Keisha's job. She works rotating shifts at the battery packaging plant not too far from here. So I watch Tori when she works late. Since we moved, I had to start in a new school and haven't made any friends. I spend most of my time playing video games or watching television with Tori. He's my only friend. Keisha just found out that I've been skipping school and said she was worried about me and I need to see a doctor. Said she thinks I'm depressed. Maybe so. I didn't tell her the reason I'm skipping school. It's because of the kids in my class. They've been teasing me since right after I started there, and now they say mean things on social media. They call me fat and a dumbass. Well, you know what I mean. I even found out that 3 months ago somebody took a picture of me in the locker room when all I had on was my underwear. They posted it on social media, and now every time I go to school, people laugh at me. I hate it, and I'm not gonna keep going there. I don't need a diploma. I don't need anything or anybody. I hate my life. I'll just disappear and Keisha won't have to worry about me anymore. Everybody would be better off without me. I said I'd go to the doctor to make Keisha happy. She always says how nice you are to Tori. I haven't seen a doctor in 3 years, which was fine with me. My doctor from the last place was mean, and I could tell he didn't like me. So here I am.
So those are the words, Thomas. So for each case, you're going to hear words. In the other cases, there'll be the parent or the guardian. But this is a wonderful opportunity for students to listen to the monologue. I don't know, let us know if any of you use our monologues for teaching opportunities in class or in clinical, or having students listen to them before you begin to talk to them about a certain common health problem. But Thomas really helps to get the context of how environment influences his ability to access health, how he sees health, and how his caregivers are at risk in that scenario. So I think we can see he has protective factors with Keisha and a home that he can live in, but he's at risk because of working, because of his obesity, etc. And it's good exercise for students to listen to that way. And the reason we chose obesity as a topic area is because these statistics you all know, that it's quadrupled, that 1/3, and repercussions from susceptibility and in Thomas's case, from depression are extensive. We're hearing from Tanya, wonderful teaching strategy. And you use the disability one, good. So Rachel used the disability one, which is great. Maybe you used it in OB or as in fundamentals. We'd love to hear. So in Thomas's case, obesity and depression, which aren't necessarily commonly talked about in the pediatric curriculum, but depression, as you know, is a major problem with the adolescent population in all kinds, according to a spectrum. Not everybody is clinically depressed, but 3% do have a major depression. And in the second scenario of this simulation grouping for Thomas, he is hospitalized for his depression. And then you pick him up in home care later, seeing how he is progressing and how Keisha can be supported to help him to make better decisions. So Rachel used it in relation to peds. Great, as an example, perfect. Our course is pediatric, geriatric together. Oh, that's wonderful. So a lot of the scenarios you'll be able to use that way. Terrific, wonderful. So there is a Thomas Sykes teaching strategy, which you can go to. This really helps students to get more into depth about depression, suicide in the adolescent population, to look at risk factors, to do an educational presentation for parents. So please take a look at that. And oftentimes this one is used in connection with the case study, with the unfolding case, so that the students already know Thomas and then they can deal with this in more depth in the teaching strategy. So that's Thomas, he's the first one, and the second case is Damon McAdam, an unfolding case. Now we're at the other end of the spectrum in peds, 2.5. He starts out with an ED visit for dehydration, and we're going to hear Mary Cato, who is the author of this case, tell you about this case. So for each of the cases on the ACE.P website, you're going to find a brief video by the authors. Here's Mary. So Andrea is going to bring up Mary, and she's going to tell you about the case, why she chose it, and where she thinks it may be useful.
The pediatric case I developed is Damon McAdam, a toddler who presents with gastroenteritis and dehydration. Contact with the child reveals developmental issues and possible child abuse, a topic that our nursing students need to be familiar with. They must be able to identify signs that a child is being neglected or abused, and to communicate to the child and the parents in a way that is honest, helpful, and respectful. Mental health and developmental issues, including autism, are being seen more frequently, and early diagnosis and treatment are critical to a child's future. This case gives students an opportunity to assess a child's development and consider what type of services will be helpful in determining his developmental level and his educational needs. This case could be used in a pediatrics or a maternal child course. Since the last scenario takes place at home, it could also be part of a community health course. All of the cases begin with a monologue, and this one introduces Damon's mother. The monologue could be used in a lecture to introduce the family, or used as a simulation prep assignment for the students. A teaching strategy that would integrate with this simulation is children with chronic conditions impact on the family. Students are asked to investigate a chronic condition in depth and consider its impact on the family, the school, and the community. They're encouraged to create a story from a family member's perspective that explains what life is like with the affected child. This could be the voice of a parent, sibling, or grandparent. Students can also be asked to discuss ways the nurse could intervene and assist the family, considering their social and economic background and the role of an interprofessional team. We encourage you to explore all of the resources and be creative in integrating them into your own curriculum.
So some of you from the simulation world know Mary Cato. She was at Oregon Health and Sciences University. She just recently retired from there, but she's been an author of many, many of our cases. So that takes you to understand Damon. And as I was listening to Mary, I realized that what I need to remind you, if you haven't already used the cases, is that there are teaching guides for all of this. So for every monologue, there's a guide that goes along with it that will tell you what ideas or suggestions for how you might use it, questions you might ask the students, activities they may do in relation to the monologue and to the teaching strategy. So that's Damon, and as Mary explained to you, Damon starts out with the first sim, a very common scenario with a 2.5-year-old vomiting, diarrhea, dehydration. And this gives the student the opportunity to really do a full assessment of this issue, which we would call a low acuity, high frequency type of occurrence. Because not every simulation, right, colleagues, has to be high acuity, low frequency. We want to really look at those common ways that listen to me, common ways that patients enter the healthcare system. And that's how Damon enters, and then the nurse picks up some bruising and some possibility questioning whether he is abused. So the next two SIMs, as Mary said, can deal with child abuse, maltreatment, and then picking up that he has some developmental delays, which is picked up from the initial assessment, and that perhaps leading he may be on the spectrum in some respect in regard to autism. So that's Damon, and as Mary explained to you, it can be used in a wide variety of ways in psych, community, etc. Another gap in the curriculum, colleagues, is how students understand the challenges of dealing with chronic conditions. And as Mary said, this teaching strategy helps the student to really look at the role of the nurse in chronic care management, which is really important, and it can be extrapolated to look at chronic care management in general. And actually, as Zelda said, the more common, I agree with you, Zelda, the more common disorders are more important, especially as clinical sites have decreased. So think of this as these are common experiences that children have in the community settings, which bring them into the healthcare system, but they don't stay there necessarily, and the treatment is done at home. Thank you, Zelda. So our final teaching unfolding case is Mia Jones, and she's a 4-year-old who lives with her mom and dad. And Mia really was done in collaboration with our colleagues at NYU. She's experiencing weight loss. Her mom notes that you'll hear in the monologue that she is cranky and her disposition may not be up to where it was before. And the nurse does a mouth assessment, which we don't usually do. She looks in her mouth and her teeth are brown, etc. And she has a series of tooth caries, which then needs to have surgery for extractions, which takes her into the hospital again. Student gets experience to work on acute care prep of a child for what would be considered minor surgery. And then she goes home. We meet Mia again with her grandmother on the playground, and she has a fall, which leads to further dental problems, because those dental abuse or lack of dental care often leads to infection, and the first problem, and playground falls, etc., without adequate follow-up are really a cause of further dental and oral issues. And why we chose this area, as I said, it's a real focus for NYU, but Dr. Satcher, when he was Surgeon General, put out a report on oral health in America, which really showed that it was reaching epidemic proportions, especially in school-age children in particular, leading to infections, eating disorders because of their mouth sores, leading to poor nutrition, and really important, decreased attention secondary to pain and discomfort in their mouth. So those 3 areas were a part of it. But it didn't really get good traction, if you will, and didn't get really a good take until DeMonte Driver, and you may know this case, died in 2007. He was a 12-year-old who lived in Maryland, sweet boy, who complained of a toothache. Now, the social determinants were alive and well in this particular scenario, in that the family had Medicaid. They were in a lower socioeconomic group, so they couldn't afford to access a provider, a dental provider, and pay for it. Their Medicaid supposedly covered it through CHIP, but as you know, access to a dentist that would take Medicaid was going to delay it months and months. Eventually, DeMonte developed a brain infection after 2 to 3 weeks and died of complications of encephalopathy. And DeMonte Driver's case just mobilized the healthcare community to realize that we needed to do something. I mean, he died of a toothache, which could have been prevented by an $80 visit to the dentist, and it cost over $250,000 in acute care, et cetera. We have got to do better on thinking about preventive care, and DeMonte's case really drove that issue, because 1 in 5 children have problems with dental caries and untreated tooth decay, and many, many people have no dental insurance, so untreated. And it's estimated that 51 million school hours are lost annually because of problems with tooth pain, tooth decay that needs to be rectified, or if untreated, then leading to more serious complications. So that's the case of Mia, and we encourage you to use that case. You'll hear from her mother in the monologue. There are many teaching strategies attached to Mia, and we use the Bright Futures assessment tool in this teaching strategy, which I really recommend to you to look at how you would assess. And there's a good assessment tool from Bright Futures for the social determinants. How there's an exercise for the students to look at Mia's case, identify risk and protective factors, and then an educational follow-up to look at what community resources. So community health, behavioral health, all of those are integrated into this social determinants of health teaching strategy. We have 2 additional oral teaching strategies which are there, which really looks at oral hygiene, the need for fluoride. For those of you who are in daycare centers or early age school children, there's a wonderful educational component to this teaching strategy to highlight teachers as well as parents to do an educational intervention related to learning good dental care. I remember taking students to a preschool, and we practiced with the big toothbrush and did all kinds of exercises related to oral teaching care. So that's part of this teaching strategy. And a second one, which is really focused on nutrition and education, and looking at the nurse's role to promote good oral health, and then eventually to prevent obesity by cutting down on sweets and those kinds of foods which lead to dental caries. So those 2 are a part of it, as well as the one on the social determinants. And finally, there's an interesting teaching strategy which we alert you to, which is related to injury prevention, which, as you know, is the leading cause of death in children, is unintentional injury, falls, drowning, etc. So in these teaching strategies, as in many other teaching strategies, we have games that you can use with the students. There's a Jeopardy game in here to help them learn the facts. And then there's teaching learning strategies that you can use in preschool or in schools to help them to know how to create a teaching educational activity in order to learn toward prevention of that illness. So I have now taken you through the major components. It took us a year and a half to develop these resources, and I did it in 35 minutes. But I hope we gave you a good overview, and we encourage you to come in on the chat room if you have other questions while Andrea goes through and shows you how to access all these resources. So chat away with us for the final 10 minutes. And right now, Andrea, if you could walk us through how you access these, that would be great.
Sure. Well, thank you, Elaine. We hope that you have been encouraged by all the resources we have shared with you, and I'd be delighted to show you exactly how easily you can access these just from any internet
And they're free.
connected computer. So probably the easiest way to get started is to start on our NLN website, or nln.org, and we have rotating banners on our website. But when you go to our website, always at the very top, you'll see our logo, our tagline, the voice of nursing education, and then we have something called quick links. And when you push the button down on quick links, you will see them right here. And please do continue to enter your questions into the chat, and some of them I'll answer actually as I'm going through the website, and some of them we'll answer after we're done. So once you click on the quick links, this is where we get very lucky for me to be in the Advancing Care Excellence series, because alphabetically we are right at the top. There are about 200 quick links, but right when you push down, you come across the ACE series, AC, ACE-D, ACE-P. So whichever vulnerable population you'd like to visit, here we'll go through the ACE-P. You can click right from there. This will take you to our ACE-P landing page. All the ACE-P pages will have this these wonderful pictures of children. That's how you know that you're on an ACE.P site. We thank our funder, and then we have 4 different areas that you can click on. One is the unfolding cases, one are our teaching strategies, one is the ACE.P framework, and then finally we have some additional resources and videos. I also have the overview video right at the bottom of this website, and you can click play right there if you'd like to hear kind of a short overview from one of our unfolding case authors, describing in about 3 minutes what we spent a little bit more time on today discussing in this webinar. So let's say we click on unfolding cases. Here you'll see that we have the 3 unfolding cases that we heard about, Damon, Thomas, and Mia. And so if you want to download or learn more about, let's say, Damon, if we click on Damon, we'll get to Damon's landing page. Now, if you're a member who has used some of our ACE resources before, we want to thank you for continuing to have interest in using the resources as we develop them. Earlier this year, we did do a few updates to the website. We received some feedback that we were having some difficulty in accessing and downloading all the resources. So we did some restructuring in an attempt to make it even easier for you to access all the resources. So whichever unfolding case you go to, here we're on Damon McAdam, one of the first things you see after you see our children and our logo is something that says download all files for this unfolding case. And that has a plus sign with a circle around it. If you click anywhere on that accordion, it will drop down and it will tell you how many files there are, and each file will be numbered, and you will be able to download each individual file. With our unfolding cases, they tend to be 10 to 15 files, and so we hope that in numbering them and putting them all in one section, it will make it much easier for you to download them.
And you know, while you're talking about that, Andrea, Zelda just asked a question, is there any way to edit? So this might be a good time to address that question.
Yes, so all of the files you are able to edit, except the audio file, though you certainly, if you have the audio capability, you can edit the audio file. And then the script is in a PDF, again, because we don't believe that most people would be interested in editing the audio file, and therefore editing the script. But everything else is a Word file. So all of this, the chart materials, the simulation templates, they are all Word documents, and we encourage you to make adaptations to best meet the needs of your students. You'll find that a lot of times in many of the simulations, we might not specify race or ethnic background, or if you feel that you want to change a name, you want to change something to better resonate with your students, you're welcome to do that. And most importantly, you don't have to ask our permission to do so. These resources are made available to you in an attempt for you to help your students learn to better serve vulnerable populations. So we actually encourage you to make edits and to make them as realistic for your students as possible. And this might be another good time to answer. I see that Heather submitted a question about the Sims in the virtual format or template for the live sim. And maybe Elaine, you can talk a little bit about that.
Yeah, so the NLN does have simulations, Heather, that are virtual. We call them the vSim series. And there are pediatric cases in that, but not these ACE.P cases. The pediatrics in the vSim series, and it includes also a geriatric series, which are the ACE-S series. So some of our ACE work has been converted to the virtual simulation format, but not these particular ACE.P. The pediatric ones in the virtual format now are from the original group of cases that were developed for simulation, the mannequin-based simulation, and they've been converted to the virtual world. So there are ACE has been converted to the virtual world. There are many categories. Please go to the NLN website. You can look up VSIM, and you'll see that there's geriatrics, pharmacology, fundamentals, health assessment, med-surg, psych. They fit your courses, and they are available. Now they cost. You have to pay for those because, as you can imagine, the platform for the virtual simulation is extensive, and the algorithms to make that happen, that the avatar would actually respond, and then whatever the student responded to the avatar has to act appropriately. So it's very complicated and costs money. And a template for the live sim, as Andrea just explained, all those templates are there. So we encourage you, where it says like simulation template, go to it, okay, Heather and others, because it will show you what people should say, what equipment you need. There really is everything there for you to guide you in your work. Thanks, Andrea.
Great, thank you. So this is how you download the files. You can also minimize the download all the files by clicking on that again. Right underneath that, we also have the individual videos for each unfolding case. So here you'll see Mary Cato, as we showed you earlier in the webinar, her video. The other two unfolding cases also have videos, and they're right there for you to use. So you can then go back to the ACE.P landing page. You can always just click on the ACE.P logo and on any of the ACE.P pages, and they'll take you back to the landing page. And let's next look at some of the teaching strategies that we spoke about. You click on the teaching strategy page, and then you'll see that for the ACE.P, we have 7 different teaching strategies. We'll click on the very first one, that one about anxiety, depression, and suicide that we spoke about in relation to Thomas. That will bring you to the individual teaching strategy page, have a short little overview. Then again, you'll see your very first kind of hyperlinked heading is download all files for this teaching strategy. Most teaching strategies only have a few downloads. Every teaching strategy always has a printer-friendly version. And so you don't have to print it from the website. It's probably easiest for you to click on the printer-friendly version. It will open it up as a PDF, and you can print that. You also have your other downloads, and then each teaching strategy will have learning objectives, learner pre-work, etc. So there's different sections of each teaching strategy.
And they all use, thanks Andrea, the same format. As Andrea said, learner pre-work, then suggested activities, and then additional readings. So, and they're all linked to certain websites. So using it in an online format and in an online course or whatever can also be very helpful because they're all linked. But I think as you use the teaching strategies, and I realize that some of you have been using them, you'll know that this summer we evaluated them and improved them so that they all have the objectives, learner pre-work, suggested activities. They all follow the format, which I think is easier.
Sure. So you can then, after you've looked through all the teaching strategies we have, if you're interested, you can look at the ACE.P framework by clicking on that. Each of the vulnerable populations in the ACE series has their own framework. This framework was adapted by one of the unfolding case authors who has expertise in pediatrics. And we can always go back. And finally, we have additional resources and videos. If we click on that, you'll see here something that I'll be taking down later today, which is the announcement for this webinar. Here we also have, it's another location where we put all of the ACE videos. So there's one ACE overview video and then one video for each unfolding case. So there's 4 videos total. None of them are over 3 minutes, so they're short videos that are fairly easy to watch, and they're directly from the individuals who develop the ACE.P resources. So it's a very nice opportunity to hear from them directly.
Great. Okay. So we don't have any other questions or comments. So if you have any more, please chat away in our last 8 minutes. But Andrea and I have been very pleased to present you this information. We're very excited about the pediatric cases, and please know that the caregiving ones are coming. But we really do want to encourage you to go to the website and look at them, recognizing the breadth of them in regard to the types of courses and different settings that all of the ACE series will give you in regard to access to teacher-ready resources that are well evidenced. And all of them were updated from the series, or in the process of being updated for more relevant references and for medications. You know, that's one thing that can need to be updated and changed. So, good.
So I do see we're getting some more chats, which is wonderful. While we're hearing a few more comments and questions, which we welcome in the chat box, I have opened the second poll. As I promised, we have a few questions that that we'd like to ask so that we can provide some metrics to our funder.
That's, you know, it's all about that, isn't it, Andrea? So hopefully you plan to use something that we talked about today in your teaching within the next academic year. We hope you'll use the wide variety of resources and ask us you know, what anything you need to know. Andrea is there. She's at the NLN. I'm not. That's why we're in two separate places. But behind Andrea is the Watergate, so you know she's on site. So do you plan to use one or more of the resources? And hopefully we've helped you to understand a little bit more, or to see the challenges of vulnerable children in those 3 areas, as well as the social determinants and ways that you can incorporate that into where your activities are and the kinds of courses that you're doing. And Andrea, where will today's recording be found?
Well, what I'll do, Elizabeth, and for anyone else who's interested in the recording, is that I am going to post a link to it under the ACE.P resources and other videos section of the website. So that should be up probably most likely tomorrow, if not by the first thing next week.
Great.
Looks like we have another comment.
Zelda's been concerned about pediatrics getting shunted aside. I agree, and I think that if we can focus it on the community and incorporate it into all our thinking about community, where most pediatric care occurs now, it will grow in stature within the curriculum, because that's why we're very excited about this ACE.P toolkit, which you'll find in January on the website. It's interactive. It tells you all the resources related to, it gives you a model curriculum on incorporating the social determinants into a pediatric curricula. And those of you who I saw that who had a combination Jerry pediatric course, well, really a combination pediatric community course, rather than seeing these topics in silos, is really the way we need to go and give pediatrics more leverage. I do think, Zelda, that this is something that will have legs, as you say, as we move forward. So, well, thank you so much. We've reached the end of our time here. Andrea and I want to thank you. Andrea is at the NLN. If you have any other questions, you know where to find us. albrowning@nln.org, but either way, you just look for us on the website and you'll find us. One last thing I wanted to say is that these resources, the ACE resources that come from grant fundings, are free. We have been, you know, they're up on the website so anybody can pirate them, because we've done other webinars where people have said they've seen them for sale. So we just want you to know we're not selling these on the website. If they've been converted virtually or to Mannequin, then there is a cost. But these should be free. You shouldn't have to buy these from another vendor. So I just wanted to say that, Andrea, as we're closing here, because the funders asked us to make these available to faculty across the country. And that's why we're asking you to tell us how many of you are watching so that we can keep tabs on how many of you, also from hits to the website. So thank you all for being here and for engaging with us. Andrea, do you want to say goodbye?
No, I'd just like to echo your thanks to our audience and just let everyone know that you're welcome to access the resources on the website. And also, I am here at the NLN headquarters. If you call and ask for Andrea or ask for the person who deals with ACE resources, you'll get to my desk, and I'd be happy to speak with you. So thank you so much, and have a nice rest of your day. So
And a wonderful holiday season. Bye, everybody. Thank you.